So bleeding during pregnancy is a leading cause of maternal mortality around the world. And despite this, over 90% of our moms never needed to die. Now, the reason the CDC cites for this is because we lack the technology to be able to predict who's at risk for these major complications. And as a result, we have poor resource allocation for our moms that truly need it. Now, to complicate matters, doctors actually have the resources they need to intervene and prevent deaths in most of these cases. But they just miss the high-risk moms at early stages, and they misallocate the scarce resources that they have. They need a better way. And that's why we got together. So I myself was a machine learning researcher and medical candidate at Brown, studying to be an OB-GYN. And I left med school, and I worked with obstetricians from Harvard and Brown, machine learning engineers, and clinical trial researchers across African countries to devise Elythea. Now, we use, with Elythea, we are a machine learning platform that can detect and prevent pregnancy complications before they ever happen. Now, the way we do this is that our machine learning models take in basic point-of-care variables. That's things like your demographics or clinical history, like your age and smoking status or your prior number of pregnancies, things that any mom would know anywhere in the world off the top of her head at her first visit. And in developing settings, we are accessible as a simple mobile app platform, and we take less than a 60-second interaction. Now, we have done clinical studies in 3 countries, and we've been able to show that we can triple the number of complications that doctors can catch, and we can do it as soon as the first visit, instead of all the way in labor, which is when they currently wait until. We want to revolutionize maternal care with this. And we have actually seen that our patients love us. Here are some of the patients that have been through our platform in our Nigerian trials. And we have been able to accurately predict complications of pregnancy for thousands more moms just like them. And we're on the grounds, as I speak right now, in over 4 African countries, conducting our randomized control trial on thousands of patients. We also are signing contracts that cover over 1 million patients in rural Bihar, in rural Indian villages that lack access to care. And lastly, we commercialized a couple months ago, and we have multiple signed LOIs and contracts that span over $1.3 million in ACV over the next calendar year. So right now, we're raising our current round, but our main ask of the community is that we would love to partner with hospital systems and governments. We want to go and impact population outcomes at scale. And we also want to work very closely with medical organizations, medical companies that work directly with patients in any capacity to be your analytics arm. So join us so that any mother, whether it's one in New York or one in Nigeria, deserves an equal right to living after giving birth to her child. Thank you.